Good morning students. Today we will see about the National Vector Disease Control Program. In this program we are seeing the Malaria Elimination Program, Kalazar, Lymphatic filariasis and Japanese encephalitis, Dengue and Dengue Haemorrhagic fever and Chikungunya. So most of these diseases are coming by the major vector is called the mosquitoes, and only few will be by the sand flea it is causing. Mainly Kalazar you can see as a sand flea. What's vector control program? Any vector control program you have to follow some main activities governments are following. That only you have to write. First they are making a formulate the policies, guidelines, technical guidelines, planning, logistics, transport, monitoring and evaluation, coordination central and state government, collaboration with the international agencies, training and facilitate the research. Either the ICM or any research centers are there. Vectors mainly by the coordination with the border areas. So one state to state, another state to state, the border will be like a flu or dengue, anything will be, they will be. First we will see the malaria eradication program. So the national framework for malaria elimination program, mainly in India, the main goal 2016 to 2020. The main goal is eliminate the malaria throughout the country by 2030. To prevent the introduction of the malaria. Completely they want to prevent. By 2024 what they want to do? To reduce the malaria into 1 by 1000 per population in all states and union territories and districts in India. By 2030 what is their goal? Main goal is eliminate throughout the entire country. And focus the high endemic area. Where is high endemic area? Where there is a tribal population is there. They are living in the hilly areas. So there is a more chance for getting the sicknesses. Okay. Main to how they will control this one. First the one what they want to do this strategy. They always main activities they are planning. According to these activities, what is the strategies mainly they are following. With the help of strategies, how they implement the strategy we will see. First is the early diagnosis and radical treatment. How they this one, and case based surveillance, the rapid response. Then any one case coming, they like a snowball, they will find out more cases. And integrated vector management. Vector how they will manage. Not only if you see the life cycle of mosquito, larva, egg, larva, pupa, adult. So not only controlling the flying vector and also all the stages they want to kill it. So indoor residual spray and insecticide and larval source management. Use a good water means they will change in indoor, they will motivate it. And epidemic preparedness for the early response and monitor and evaluate, advocacy, coordination and partnership, behavioral change and communication, BCC. Whatever you do, if their behavior of the individual not change, any communicable disease cannot be controlled. Then program planning and management. According to these strategies, what they are doing, first one is called the, and keeping it in the mind to control within this year, what the activity plan, what they are doing. First is the surveillance. Surveillance in the case detection. Who is detecting the case? All the periphery level workers, MPWs, multipurpose health workers, Anganwadi workers, ASHAs. So the report in the periphery health workers will be going, and after that the report they will do the immediate rapid diagnostic test given to them. So these tests, this one will be rapid kit will be produced by the various research ICM or some they are giving us. So with this kit immediately you can diagnose, so no delay will be there. And then integrated viral management. Here will be the adult mosquito control will be there. So this integrated residual spray also they will be doing, and anti-larval measures they are doing, and each individual they were motivating to wear the long sleeve clothes and the mosquito nets they are doing. And the BCC, like communication and education, early signs, they should not delay by treating like their own medical, this one, immediately they have to seek the medical help and adhere to the regimens, whatever the treatment regimens they are giving. Then often they conduct the important areas, the anti-malarial campaign with the doctors and nurses. So this will be really helpful to control the malaria to achieve the goal of 2024 and by the 2030. So this is the how you have to write this one. So this is a strategy you have to write, and this one you have to write. So next, if you see, this one is called the elimination of lymphatic filariasis. This also a vector called Culex mosquito. This national filaria program has been operated since 1955. So main filaria control strategy, if you see, anti-larval operations, they will kill the larva before coming to as a vector form, and source reduction. So what they do in the source reductions, in the which water, Culex mosquito always will be in a dirty water, so cover the drainage, putting the kerosene oil there. Who will be putting it? Same Anganwadi, Asha, other workers will be putting it. And treatment for the carriers who are all having the carriers, and morbidity management and IEC to behavioral change communication will help them to change their behavior and attitude, right? So the elimination, it is like a before, it's a between the eradication, eliminate, we want to first eliminate, then we have to eradicate. The elimination strategy, they are doing the annual mass drug administration, single or anti-filarial drugs has been given. So except they are giving for the pregnant woman, mass drug administration they are telling, that's called the MDA, mass drug administration. They give for everyone except the pregnant woman and children, and the children less than age 2 years. And then home based management, home based, each home they will go, Asha and people will be going and giving them health education and helping them to reduce this vector and the source reduction program. Next, if you see, this is called Kalazar. Kalazar, mainly this disease is caused by the sand flea. If you see this Leishmania, which will be the affected person's Leishmania larva, maybe you will find out in bone marrow, spleen and liver. It's a very dangerous disease. It's an endemic area, 33 districts affected. Actually, it is called the black fever. Okay, strategies of this one: enhance the case reduction. What is RDK? Rapid diagnostic kit, and interruption of the transmission of the vector control and eliminate the sand flea. Main thing BCC, that's help to behavioral change communication through IEC. Okay, capacity building and monitoring and the supervision and elimination, this one, and continuous research to, so that this research will help to prevent the next year. Then will be the active case detection, Kalazar fortnight for the 2 weeks, door to door. The peripheral health workers will be collecting the samples and sending to that. Who are the peripheral workers? Asha will be played. Okay, case deduction is Asha, government is paying nearly 300. If Asha involved into the spraying, residuals control, larval, this one, they are 100 rupees, they are 2 round, they are paying 200 rupees. In this case, patients also, the government is paying 500 rupees per day. So Kalazar eradication launched in 2nd September 2014. Till we cannot eliminate, so they have introduced the incentive program for the Asha workers as well as the patient to eradicate. Who developed the kit? ICMR developed the diagnostic kit. Single dose treatment also given. So liposomal amphotericin they are giving IV 10 milligram per kg body weight they are giving, and to reduce the human reservoir of the infections they are. Who is supplying? WHO also supplying this main drugs. Understand? Next, if you see Japanese encephalitis. So Japanese encephalitis is also a high mortality rate in India. Mainly this major health problem in India. Neurological complications will be coming. So what will happen? This one, Andhra Pradesh, West Bengal, Assam, Tamil Nadu, Karnataka, Bihar, Maharashtra, Kerala, Manipur, Himachal Pradesh and UP. Main strategy is strengthening the surveillance. The surveillance, how you are doing this, that much you can control the disease. Early diagnosis, proper case management, integrated vector control, larvicidal everything, personal protection and grow of larvivorous fishes, Gambusia beasts. So these fishes in overhead tank, if they get, these larvae will be ate by these fishes. And capacity building, BCC through IEC program and need based assistance to all the states which is highly affected, and support and training and social mobilization and the case management, very very important case management, and vaccination has to given to the 1 to 15 year age, and keep away the picklets. Piglets are the pigs from the human dwelling area. So from that only the vector is transmitting. And cloth should be cover the whole body, and epidemiological monitor and implementations and the prevention and control. So this is about the Japanese encephalitis. It's a high mortality rate because of the neurological complications. So everywhere you have to follow these strategies in any communicable program. You have to remember the strategies. Okay, what is called dengue? You know very well the dengue. Even currently also many people are dying. Now current news came that within 1 month 24 to 40 people has died in dengue now currently in Tamil Nadu. The dengue outbreak started from 1996 outbreak rapid in Delhi. Early diagnosis case avoid the complication and the mortality. So early diagnosis is very important. So how to the dengue will be prevented by Government of India? Monitoring, surveillance, right, reporting, and mid-term plan for the prevention and control, surveillance, case management, vector management. Vector management will be source control, chemical control, personal protection. Same source control. Where is the source? It's a good water or bad water. Dengue is a female anopheles mosquito, so it is in a clean water. So how to control the clean water? Near the door to door they are sending to the workers to see the refrigerator, investigation, open vessels, storage of water, all has been closed, and all debris from their house has been removed, and the chemical control, they put the chemicals, and then personal protections like net, mosquito nets, and health education, behavioral changes, wear the long sleeve clothes. Outbreak response, the epidemic preparedness should be very immediately, and media has to manage it. And capacity building, training and strengthening the human, strengthening this one, and human research and operational research. As I told you, PCC, IEC, social mobilization and intersectoral coordination, minister, panchayat people, parliament people, supervision and feedback. Understand? Then will be the chikungunya. Chikungunya is the fever. It is also a non-fatal viral illness. It's re-emerging disease. Excuse me, re-emerging disease in after 3 decades India. Government is monitoring the strategy. If you see the same strategy, you have to write. Are you understanding? Monitoring, because this is also called by mosquito disease. Also here the diagnostic kit has been provided by the National Institute of Virology. They are giving freely. Understand? So that kit will help to the same strategy you have to write here. So today we have seen about the National Vector-Borne Disease Control Program. Mainly we have seen malaria, Kalazar, lymphatic filariasis, Japanese encephalitis, dengue and dengue hemorrhagic fever, and chikungunya. Dengue only will lead to dengue hemorrhagic fever. Thank you.